Ya estamos en El Salvador.
So I'm very excited. Today's the first day of the clinic. We're already getting patients in. It's the first time that I'm attending Priventa Health.
I got Cesar over there. He's a local nurse from one of the hospitals. He's volunteered to do intake. We're gonna get some information from the patients and ready to rock and roll.
We're seeing different things going on as far as different demographics and also like the type of issues we're seeing. And they're very appreciative. I have one patient tell me like they're so grateful that we're here because they can't see a regular physician on the routine and everything's so expensive what they were telling me. So it's really nice that we're helping them out.
Dr. Shekabai has created a non-profit organization dedicated to increasing primary care access and preventative health care across Central and South America. The team he has gathered for this campaign is filled with kindness, education, and a heart to help others.
Day number 2, we saw almost 250 patients yesterday, and they're getting more of the word out to the community, so I'm hopeful we'll see more than 250 patients today. And looking forward to another great day.
It's going well. We're busy. We're super prepared today. We got everything organized in a few minutes before we started seeing our patients, and it's been non-stop ever since, but going well and reaching out to a lot of the community and saying hi to people.
This is the patients we've seen. As you can see, we've been busy. This morning we've seen at least close to 200 people so far. At noon, we have a lot of medication. We're starting to run out of a few of them, but we are improvising.
The congressman brought lunch for us, which was really nice, and they're going out and door to door and telling patients to come. A lot of people that even live in this neighborhood are not even aware of the school, so it's a great way to make them aware that this resource is here for them.
Así que usted recuerde que tiene la evaluación, ¿verdad? Completamente gratis, ¿verdad? Así que con medicamentos gratuitos. Sonrisa de un jardín de amor.
Only thing I can say is thank you for what you're doing for our people, for our community here in Colón. And also, we would like to thank everyone for what you're doing for our people in El Salvador.
It's our
Thank
pleasure.
you to bring health, to bring medication for them, and to spend the time and for them. Thank you so much.
It's our pleasure. Thank you.
I have seen probably about a half a dozen gynecologic patients, and the people are so beautiful and kind and loving, and hopefully we'll be able to help them, have access to some of the things that they need. It'll be like whoosh, whoosh, whoosh. That's the baby. That's the baby's heartbeat. That's the niña, niño. Niña. Doot, 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 doot.
We stopped at a local pharmacy right now just to get extra medications to be able to help for the extra patients that we have today. We'll see them soon.
Okay, here's more. Look at that.
Yeah, we actually.
I cleaned them out. That's great.
Yeah.
I cleaned out the pharmacy. Why?
Yeah, because we need.
That's all they had. Plus, they had to go into another one and get 20 more. So. Oh wow. Okay.
How much was each one?
You don't want to know.
Yeah.
I paid like $400. Yikes.
Yeah.
Okay. Well, we got plenty now.
It should last us.
I can't think of a better thing to spend money on than children's vitamins. Yeah. For poor kids. Absolutely.
I'm very grateful for this opportunity, being able to serve other people.
The population here, they are just the kindest people with such pure hearts.
We should be wrapping up pretty soon. This is our last day here in Colón before tomorrow when we go to Arcatao.
¿verdad? Pues hemos pasado todos, pues hemos recibido nuestros medicamentos, ¿verdad? Y vamos contentos, ¿verdad? Muchísimas gracias.
It means a lot. It means a lot. It's like the achievement of a dream and a vision that I've had for years now, and to finally see it come to fruition is beyond words. It's like surreal. Working together and just human beings serving other human beings doesn't get any better than this. This is what's left.
Day 3.
We went through a lot.
We used a lot of stuff.
First stop done. This was a very wonderful experience here working with the people in Colón. Next up, headed off to Arcatao.
Thank you.
So we're okay, but now we're gonna heading back up. It's about like 2,100 feet where Arcatao is. So hopefully we make it still. Hopefully.
Now we're here in the city of Arcatao. It's part 2 of our medical mission. It's a different area than the one that we were in before. It's in the mountains and it's near the Honduras border. Earlier we went to go and stop at a pharmacy to buy some more meds. Eye drops, ear drops, nasal sprays, that kind of stuff. And hopefully we'll be at the site in about 40-45 minutes or so.
We made it up to the mountains of Arcatao. It was a crazy ride, really warm. It's about 95 degrees right now, but we made it. Time to get set up, get the pharmacy loaded up, get all set up for tomorrow, and reach out to as many people as possible. Very excited.
We made it, oh my God. 4-hour drive, it was turned into a 6-hour drive. We finally made it. We're here at their medical facility. It's a beautiful little village here, surrounded by trees and forests. Just trying to figure out the layout and then we'll unbox all the meds.
All right.
Create a section for maybe like eye drops.
It's going good, we're unpacking. A lot of work to do.
We can create just like one section.
So we've just been unpacking everything, getting all the medications ready, labeled, so that tomorrow we hit the ground running. We get the meds out quickly. We see the patients as quick as we can because we have a lot of patients that we're expecting tomorrow, probably over 300 tomorrow. So. This is first day of the Arcatao clinic. They told us to expect about 250, 300 patients to come in today. And honestly, I don't know what types of medical conditions they have. Today's gonna be a really good day of discovery and assessment. Ready to rock, man. I got like 6-7 hours of sleep. I woke up to like a symphony of birds and roosters and dogs and any other animal that they have here. So ready to go.
We have a laceration of the finger. We have to find out what happened. I'm not really sure. But we're going to cleanse it. We're going to find out what we have in the clinic and get it fixed.
I just got some news from the Ministry of Foreign Affairs. They said that there's a bunch of people that are in Honduras that are walking across the border to get here to be seen. It's like a 4-hour walk. So these people are literally walking from their homes across the border to be seen. And the closest hospital is just too far. So we're gonna be the only facility and team that's gonna be treating them. It just goes to show like how underserved these folks are.
The Priventa health team and the Salvadorian government came together and found a way to send medical trucks into Honduras to provide transportation for the patients to and from the clinic.
Just got back from Honduras. We transported some folks from the school in Honduras. We expect probably there's going to be more and more of these trucks full of these folks. They're waiting at a school in Honduras. They're being picked up, transported here by the Salvadoran government, and we're going to be seeing them shortly.
We got lots of patients to see, so we have pre-labeled everything. We've organized the different meds as best as we can, and again, we're just trying to get them through as fast as possible. And they're wonderful people.
We're out of Tylenols. We have exhausted all the Tylenol. We still have some medications to give, but with all the patients that we've seen, we've exhausted some of our medications.
I had to go and get some vitamins because we're running low on adult vitamins. It's like 50 pills for like $8. They don't have anything else, and they don't have another pharmacy that has vitamins. So running a little bit low, but we'll do what we can.
Day one, done.
See. Long day, but worth it.
Last day of the mission, and they're still transporting people from Honduras. So we'll do our best we can to see as many patients as we can. People are waiting and ready, so let's rock and roll. This is the last day.
Just checking children and their families and getting to know the culture here. It's wonderful.
We have about 18 people on our team, and we have about 6 nurses, 8 physicians, and then we have some support staff as well.
Oh, hey.
Well, thank you so much. It is a pleasure for us to have you here. As I explained to your team, this is a town that is far from San Salvador, so sometimes reaching the health services is not easy for them. It's a challenge. We are trying to bring all the services, and that wouldn't be possible without your support, so we really appreciate what you're doing this weekend.
Yes.
Some of whom have never had access to medical care, and helping out in however small a way we can. It's been a really, really powerful experience.
We are very thankful for every donor, everybody who's been here participating, helping in any way. We hope to even serve more patients through more volunteers next time, more physicians, more pharmacists. We could use of dentists and people from all kind of backgrounds. So the people have been very nice, very grateful. They continue to be very grateful, and they are very happy that we're here. And we hope to be back, and we're sure we'll be back.
Little messy. Oh, she made me one too. Look at that. Oh, thank you. Oh, you're so sweet. And, just going out for trying to buy meds, I realized how expensive medications are here in this country. So anything we can do to lighten the burden for them and give them medications that they really need, it's just a service in and of itself.
Good morning. Gracias a Priventa Health.
Beyond treating them with medications, what we're trying to do is really provide some education to the patients, mostly based on prevention. Thanks to everybody who donated to the GoFundMe campaign and all the private donations that we got. I mean, all these donations pretty much went to buying these medications. Some of these medications were pretty expensive also. And so a huge shout out, thanks to everybody who donated. These donations are all being well spent here in the pharmacy, handing out medications to the folks who need it. All in all, very successful. We couldn't have done it without contributions from everybody out there that has donated to the campaign. Again, huge thank you.